Good day, class. In the previous videos, we have introduced the application of the 5 Su points. In this video, we are going to continue the discussion on the clinical application of the special points. In this video, we are going to start from the Yuan source points and the Luo connecting points. The Yuan source points, Lin Shu, the second volume of the Huangdi Neijing, described as the diseases that's in the the diseases of the 5 organs, we need to select the 12 Yuan source points. From this clause, we understand that the Yuan source points can be used for internal organs on specific organs. For example, the Yuan source points of the lung, we can use for the lungs problem. The Yuan source points of the spleen we can use for diseases that are related to the spleen. From this clause, we also understand that the Yuan source points have the function of have the efficacy of treating diseases. These points also have the diagnostic value. What do I mean by diagnostic value? When you palpate on these points, if you see some changes, sometimes not obvious, but when you palpate, the patient feel tender or sensitive, or even pain, or different sensations that's different from other areas, then this also may indicate the affected organ has been, or the affected organ may be affected. So you also can use the Yuan source points for your diagnosis. The Luo points, the Luo connecting points. These points connect the external and internal, or superficial and internal meridians, especially for the coupled meridians. For example, the lung and the large intestine, the Luo connecting points. So when you choose the Luo connecting points, it can help you to treat the diseases of both meridians. Both meridians for the coupled meridians. For example, the stomach 40, just double check the number, Fenglong, the one we have mentioned quite a few times. F-E-N-G, Feng. The one is very good for clearing the phlegm. Stomach 40. This point can be used for any kind of phlegm, no matter visible or invisible phlegm. The visible phlegm can be the phlegm that's coughing from the lung. The invisible phlegm, such as the mental disorder, madness, abdominal pain, so anything block the meridian, or you can see the greasy tongue of the patient. So we can use stomach 40 or stomach 40. We also can use these points for such as the swollen feeling, or distending feeling, or edema, diarrhea. The reason why we can use stomach 40 for these different symptoms is because these symptoms are related to the spleen. The Luo connecting points can be used to treat both of these meridians. The Luo connecting points can be used for the diseases that are related to the coupled meridians. If both of these meridians are affected, then you can choose the Luo connecting points. The combination of Yuan source points and the Luo connecting points. The reason why we need to discuss this is because very similar to the previous discussion in the prescriptions. in a group of prescriptions, in a group of the acupoints in one prescription, we have some dominant, some assisting points. When we choose yuan source points and luo connecting points, which points are dominant, which is assisting? So there are some principles you can follow. Firstly, the coupled meridians, both of them are affected. You can choose. You can see which one comes first, and then you use the first. The first appears as the dominant. For example, a patient suffers from cough, difficulty breathing, tachypnea, chest oppress. It's something related to the lung. And then after a few days, the patient presents as abdominal pain, diarrhea, or constipation that's related to the large intestine. The lung and the large intestine are the coupled organs and coupled meridians. The patient suffers from the coughing, tachypnea, chest oppress first, and then abdominal pain and diarrhea or constipation. So in the treatments, I'm going to choose the lung, the yuan source points of the lung meridian, the hand tie-in, and then accompanied by the luo connecting points of the hand yangling, the large intestine. In the contrary, if the patient suffers from the large intestine first, diarrhea, constipation, and after a few days, the patient suffers from cough, tachypnea, difficulty breathing, then we can use the yuan source points of the large intestine, which is the large intestine 4. And then we can select the luo connecting points of the hand tie-in meridian, the lung meridian, the luo connecting points of the lung 7. The second application of the yuan and luo points, you also can see the dominant symptoms or the main complaints. The most important symptoms or the most discomfort that the patient comes to you, you're going to see that the yuan source points of that meridian. Again, we use the same example. A patient suffers from cough, tachypnea, difficulty breathing, sore throat, accompanied by mild fever and slight headache. In this situation, we can choose the yuan source points of the lung and then accompanied by the large intestine. The luo connecting points of the large intestine. So the application of the combination of the yuan source points and luo connecting points. The dominant point is the yuan source points of one meridian. The accompanied or the assistant points is the luo connecting points of the coupled meridian. So that's the principle. So this is the table of the yuan source points and the luo connecting points. The back through points or the back transport points, and the front move points or the alarm points. The back through points also very important for the diagnostics. You can palpate, and if the patient have some discomfort or very different sensation, it also may indicate the problem of that organ, especially pain, numbness, or sometimes not that sensitive as other areas. So there's some abnormal. Once you realize, you may suspect that the affected organs may have some problems. The back through points, mainly for deficiency. So this group of points have the function of reinforcing, strengthen the antipathogenic qi, can be used for deficiency. especially the deficiency of Zangfu organs, chronic diseases of Zangfu organs. The front Mu points, or the alarm points. These points locate in front part of the body, and the characteristics of these points are very different from the back Su points. These points are mostly used for excess syndrome, so which means these points can reduce. The back Su points can reinforce, can tonify. So that's some principles you can think about for your excess syndrome and deficiency syndrome. The front Mu points can be used for excess, can activate the qi and blood circulation, which can, once the qi circulation be activated, it also can be used for relieving pain. So it can be used for the acute stage of the Zangfu diseases, such as the abdominal pain, 中脘, or something related to the liver. In the clinical application, sometimes we also combine the back Su points and the front Mu points, or the alarm points. One of the theories also from the classic, the front Mu points, the alarm points, locate in the front part of the body. The back Su points locate on the back. One is the yin, one is the yang. So comparing the back and the front part of the body, the chest and abdomen. The chest and the abdomen is yin, the back is yang. So in our treatments, we can select both of them. This is a theory from 黄帝内经. He says that the most skilled needling technique, we're going to lead the yin from yang. We're going to guide the yang from yin with the yin and yang. Same as the explanation of the characteristics of the front Mu points. The front Mu points can be used for access is a yang symptoms or yang syndrome. So the front Mu points can be used for Fu disease, yang disease, yang organs. The front Mu points can be used for yang syndrome, heat syndrome, excess syndrome. That's all yang categories. The back Su points on the back. On the other hand, it can be used for yin, from yang to yin, from yin to yang, to opposite sides. So the back Su points can be used for Zhang diseases. Zhang is the yin syndrome, cold syndrome, deficient syndrome. All these are in the yin categories. So this is from the theory to guide the yin to yang, to lead the yang to yin, from the classic. However, these are only the general principles. The reason why we're saying so is because the points, the back Su points, especially in the upper part of the body, also can be used for external heat, can be used for excess syndrome. The front Mu points, the alarm points, in the lower abdomen, that also can be used for deficiency, such as the CB4, CB6, the Ren 4 and Ren 6. So these in the lower abdomen always can be used for deficiency. So these are some of the examples and some of the principles in the clinical applications. We can be very flexible to use them. So don't stick to these principles. The combination of the back Su points and alarm points also presents as the combination of yin and yang. One's in the front, one's at the back. One's yin, one's yang. So as it described in 黄帝内经, it says the gallbladder deficiency, the patient may present as counterflow of the qi. So the qi of the gallbladder may counterflow. So in this situation, the patient will present as bitter taste in the mouth. The treatment for this situation, you can choose the alarm points and the backsu points of gallbladder. So this is the original clause from 黄帝内经. It clearly illustrates the combination of the backsu points and the alarm points. This is the table for the transport and alarm points. The clef points. The clef points are very important for the acute stage, for the emergency. For example, a patient suffers from stomach ache. You can use the clef points of the stomach. Sometimes the patient can feel relief immediately. So the clef points of the stomach is stomach 34. If a patient suffers from severe pain on stomach 34 when you palpate, you also can suspect the ulcers or severe ulcers of the stomach, especially the bleeding. So the clef points can be used for acute stage, for emergency, for different kinds of pain. It also can be used for diagnostics. So all these points that we have introduced, many of them can be used for diagnostics. The clef points of the in meridian, some of them also can be used for bleeding, for different types of bleeding. So the function of the clef points can be used for the acute stage, the acute diseases, for emergency, for the pain of the meridian, or the organs. Use the clef points of the in meridian can be used for bleeding. So this is one of the most important categories. The 8 influential points gathers blood 11, the blood gathers blood 17, marrow gathers GB 39. So if you remember these different categories, once you see some diseases that are related to the blood, you can always choose blood 17. If something related to the zang organs, you can choose liver 13. For organs, you can choose Ren 12. So these 8 influential points give you general categories of the diseases. The combination of the clef points and influential points, we also can combine them in our treatments. For example, a patient suffers from acute asthma, the asthma acute attack, tachypnea. What we can do, we can choose the clef points of the lung meridian. We're going to check the number from the previous slides. And then, in the meantime, I can select the Ren 17, 盘中, because this is the qi influential points. The qi gathers on Ren 17. The tachypnea, the acute attack of the asthma, is the disorder of the qi. The patient breathing, the respiratory function doesn't function well. So these are breathing, something related to the qi. So I can select the clef points of the lung. In the meantime, I can select the influential points of qi. So that's one of the examples of the combination of the clef and influential points. The low C points. The low C points mostly refers to the 6 organs the qi of the 6 full organs that gathers in the lower extremities, especially on the 3 yang meridians. The lower C points mostly used for the full organs. So we're going to treat such as stomach 36 to treat the stomach problem, 37 to treat the large intestine problem. So they mostly applied in the diseases of the full organs. The 8 confluence points is the points where the 12 main meridian cross with the actual points. The actual meridians. So, which means if you use these 8 points, it can help you to treat the main meridians and the diseases related to the actual meridians. You can refer to the meridian differentiation. We give you the examples of those actual meridians. You can choose these points for those diseases. Pericardium 6. During our discussion, we have mentioned quite a few times. Pericardium 6 can be used for the heart and the chest. For the diseases that related to the heart, to the chest and the abdomen. Why does pericardium 6 has this function? That's from the 8 confluence points. So these applications we also can use as a combination: spleen 4 and pericardium 6, Sanjiao 3 and bladder 12, GB41, Sanjiao 5, lung 7, and kidney 6. So those are indications. The last category is the crossing acupoints. The crossing acupoints that refers to the points that have 2 or more than 2 meridians that cross on these points. There are about 90 acupoints that falls under this category. So you can refer to your textbook, to the table. It's mostly used for multiple meridians. Mostly used for diseases related to different meridians. So you can use 1 point for multiple meridians. For example, the stomach 8, 头围, is the crossing points of the foot Yangming and foot Shaoyang. So when you use stomach ache, you can use Yangming headache and Shaoyang headache. What's Yangming headache? That's the pain in the forehead. Shaoyang headache is the pain on the side. So you can use stomach ache. So stomach 8 for both the headache in the front head and on the side. That's because of the crossing acupoints. In this video, we mainly discussed the clinical applications of the special points, including the back-zu points, the front-mu points, the clef points, the yuan source, and the law connecting points, etc. This is our last lecture on the general introduction. On the next video, we are going to continue the discussion on specific diseases. As you can see, we actually spent quite a lot of time on the general introduction. We need to focus on the general introduction. The reason is because once you understand the information in the general introduction, you can apply this information, these knowledges on the specific discussion of diseases. Even with different diseases, you can apply these theories on those diseases. That will make your life much easier when starting the specific discussion, especially for the understanding of the selection acupoints on specific diseases. Thank you for your attention.